Hey everyone, my name is Dr. Tyler Kay from Essential Health and Wellness here in Columbus, Ohio. Low back pain is the most common reason people seek healthcare. So I am here to guide you in the right direction and tell you what we can do to help you out. There's a lot of myths behind low back pain, and that is my goal, is to kind of debunk those and help you better understand your condition. So myth number one is that low back pain is life-threatening. Less than 1% of low back pain is a red flag, meaning tumors, cancers, infections, fractures, anything like that. So less than 1%. So that's, obviously a great thing. Our job as clinicians is to rule those out initially. So myth number two is people think that they have to live with low back pain. Low back pain over 90% of the time is responsive to some sort of conservative care. Low back pain is not dependent on age. So the older you get does not determine the persistence of low back pain. But the activity level and your mindset do play a huge part in that. So that's bringing me to my point number three. Negative mindset, fear avoidance behavior, negative recovery expectations, and poor pain coping behaviors are more associated with persistent low back pain than tissue damage that you may see on an image. Those said images or scans, MRIs, X-rays, CTs, anything like that, do not determine the prognosis of your low back pain, the likelihood of future low back pain, and do not improve the clinical outcomes. Number five now. So a huge belief and myth is that bending forward from the back is actually bad for your spine. And that is not true whatsoever. Moving in all directions, using the spine, what it's made to do, is actually signs of a healthy spine. Number six, spine posture during sitting, standing, or lifting. They do not predict low back pain or its persistence. So sitting in a static posture for 8 hours can bring on low back pain, whether it is good posture or bad posture. If you're not moving, you're going to get stiff and you're going to have pain. Myth number seven is that a weak core is the cause of your low back pain. Weak core does not equal low back pain. In fact, a lot of people with low back pain tend to overuse their core muscles. While it's good to keep your core muscles strong, it's actually very rare to actually see a true weak core. So going back a couple facts or myths, spine movement and loading the spine is actually really good for your low back. A lot of people think weightlifting is bad for you and causes injuries. That is not true whatsoever. That actually builds resilience in those tissues of your spine. So when people have flare-ups, people think that there's more tissue damage or more wear and tear. That's not true at all. So flare-ups are actually more correlated to stress, mood, new movement habits, but it's not due to increased tissue damage. So effective low back pain care is relatively cheap and safe. The North American Spine Society suggests chiropractic care as part of their guidelines.